MEDLAB 2019. I'm here in the Speakers Lounge with Dr. Robert Sautter. Hello, Dr. Robert.
Hello, how are you?
I'm good, thank you. You've been speaking about a very interesting topic, Robert. Can you tell us, what should you not be doing with microbiology?
Well, that's a very important point. You know, there are some things that you should be doing and some things that you should not be doing. One of the things that you should not be doing is you should not ignore pre-analytical testing. One of the most important things, responsible for 70% of errors in laboratory testing. You need to work as a multidisciplinary team with nurses, physicians, pharmacists, laboratory techs to be able to get the right specimen into the laboratory. It really proves if you can't do that, garbage in and garbage out. If you get a bad specimen in, then the bad results come out. So what you should not be doing is ignoring that process. An example of this would be blood culture contamination. When you contaminate blood cultures, a normal contamination rate that is supposedly acceptable is 3% or less. That's way too high. If you're positive, true positives are 3%, that means it's a 50% likely that a positive is real. That's flipping a coin. So you should not go on that. Try to lower the contamination rate as low as possible. And by doing that, you have to use a multidisciplinary team to do it. So that's one of the most important things, but that's true for every specimen in the laboratory. So blood cultures are just an example of that.
Well, thank you very much, Dr. Robert. You've told us what not to do in microbiology, but what should you do?
Well, I think one of the most important things is to be at the table in discussions. And I think if you're not part of a multidisciplinary team or a diagnostic management team, then you're not invited to the table. You need to be part of it. For laboratory medicine, we need to be the lead on those committees. But for diagnostic and other areas, we should be at the table. And I think the important thing is what you should do is keep an open mind and be a teammate and to make those decisions so that patients get the best care possible.
Well, thank you very much, Dr. Robert, and I cannot believe that you are turning 70 this year. You look fabulous.
Well, thank you very much.
For more information, as always, you can log on to the website medlabme.com.